Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
All right, welcome back to the Sit and Stay podcast presented by RipsyTech. You are joined by your usual hosts, Parker Anderson, and I'm joined by Tom Tarshis. Hey, Tom.
Hey, Parker. Good to see you, sir.
Good to see you. Today is a very special episode of the podcast. We are honored to welcome a very special guest, Dr. Steve Khachi, a Stanford-trained physician and founder of the Mind Study Center in Pasadena, California. Dr. Khachi specializes in psychiatry for all ages with expertise in psychopharmacology and psychotherapy. He holds a BS from UC Santa Barbara, my alma mater, go Gauchos, and an MD from the University of Wisconsin. He completed his psychiatry residency at UC San Diego and a fellowship at Stanford, where he served as chief fellow. He currently is on the voluntary faculty at USC's Department of Psychiatry and Behavioral Sciences, and his extensive background spans diverse clinical settings, and his dedication to integrated evidence-based care has made him a leader in the field. And his list of accomplishments is so impressive, I couldn't fit all of them into this introduction. Welcome to the podcast, Dr. Khachi.
Thank you so much, Parker, for that kind introduction. I feel truly honored to be here today, and this is a fantastic platform. I feel fortunate to be here.
We're very happy to have you. So for today's podcast episode, we wanted to talk a little bit about you and your background, and we have a list of questions that we would like to go through. So I think just to start things off, let's dive right in on, why did you decide to become a mental health clinician?
Oh, this is a complex question. I have to answer it in a few minutes, so I'll do my best. I studied biochemistry and molecular biology when I was in Santa Barbara, and I loved chemistry, and I took a biochemistry class, and I was so excited to see the direct application of chemistry in human body. And the more I got into biochemistry, the more I was fascinated about these molecular interactions that makes complex species, humans and all animals. And with that, I decided to pursue medical school and study medicine, how I could utilize my passion in biochemistry and physiology in affecting people's lives. Interestingly, I did have to take actually a psychology class as a general ed, and I was just immediately fascinated by this other organ in the body, the human brain, and its impact on behavior, mood, thoughts, mental health. I was just so excited learning about the complexity and mysteries about the brain. So with that background, I started medical school, and right away I knew that I love neuroscience. I love to learn and understand this, again, sophisticated organ, and with all the neuronal network and such, that actually after my second year of medical school, I decided to pause medical school, and I went on to do 2 years of research. I went to UC San Francisco for a year of research there. And then afterwards, I actually got a very nice scholarship or fellowship. It was called the Howard Hughes Medical Institute Fellowship, which funded my research to go to the NIH, National Institute of Health. And it was really interesting. They brought 40, 50 medical students to live in a house inside the NIH. And we lived there, and we did science for a whole entire year.
Wow!
It was. I look back. I'm like, it felt like a science boot camp, and there we were very fortunate. We would have guest speakers every week in a very intimate sort of setting, with dinner with Nobel laureate and Nobel Prize winners in different fields coming and giving us talks. I was really interested by the work that Eric Kandel had done also. He was a psychiatrist who actually won a Nobel Prize in delineating how the biological mechanisms of memory, which was another phenomenon of human brain that was very interesting. With that mindset, I came to medical school. I thought I want to pursue neurosurgery. I think I loved the human brain so much. I'm like, I got to touch it. I got to get in there. But soon after a bit of rotation, I realized, in neurosurgery, still not answering the questions I had. How does the human brain work? What are the impact of mood, thoughts, feelings that comes as a result of the function of this organ? And then right after my psychiatry rotation, I'm like, wow, this is the field. This is the field that brings all of my passion and integrates it all together in one specialty: neuroscience, biochemistry, the desire to help people improve their quality of life and reducing stigma surrounding mental health conditions that I believe happens as a result of difficulties within the brain. And with that, I started my career.
Well, that's amazing, Steve. And actually, I've known Steve for some time, but I don't think I've ever fully heard some of that origin story. So I was thrilled to hear that. I was thrilled to hear that. It was great to get that extra context.
Yeah, it's been a really interesting journey, and I always say that I am fortunate to be in this field that's always changing and always advancing for better.
So I saw that you're certified for adult psychiatry and child and adolescent psychiatry. What led you to child and adolescent psychiatry specifically?
Great question. When I was doing my general psychiatry or focusing on adult mental health, I started seeing a pattern that I felt that I could have been more effective if I was there earlier in these adults' development. And soon I learned that if I could change or have an impact early on in childhood just by a bit, I'm able to change the trajectory of many growing adults years after. And child and adolescent psychiatry felt just the right fit. And I feel that it just completed really my focus and passion for psychiatry as a whole. And sometimes I say I feel even I'm more equipped as an adult psychiatrist when I'm treating adults because I have a child and adolescent psychiatry background, and it just brings it all together. Now I am not sort of limited to one age group, but I can see the lifespan. And that's how it started, and I'm so happy to be part of the small child and adolescent psychiatry sort of team. There's not many of us out there, and I'm hoping that there will be more and more physicians and psychiatrists get into this field.
Yeah, and Dr. Khachi's comments about, I mean, we all hear prevention's the best medicine, and I think that was the reason Dr. Khachi gave for doing child psychiatry. Well, mine was mainly to play video games with my patients, but the reality is you do learn. It becomes very clear when you're seeing some adults that, boy, if someone had just been there when this person was 12 or 13 years old, you really can, it makes our jobs easier actually to change the trajectory. And it's can be a lot more hopeful experience, I think. And I think Steve would echo that.
And then with even, as you said, Tom, even with the smallest change for 1 degree, we can see how much impact it has down the line. And the other thing is, if I can be slightly effective of reducing stigma at such an early age, that as adults people would feel comfortable going and seeing a mental health clinician without all the stigmas that we hear.
So you, as I mentioned, you founded the Mind Study Center in Pasadena, California. Tell us a little bit about that. How long have you been in operation, and what was the process like of getting started?
Yes. Well, that's a complex question too, but let's get in there.
Only the hard questions.
Yes, again, from my background, as you heard, I was absolutely pursuing a very academically oriented sort of career path. Uh, but the longer I practiced, especially in fellowship, the more I realized I love clinical practice. I love what I can do with each patient, and and with that mindset, I came here to Los Angeles, and I started solo practice for 2 years. And it felt that I am missing the big picture, how I can be effective to my patients as a whole, and having a more holistic approach. And that's what I had really enjoyed at Stanford, having other mental health clinicians coming together in a very collaborative way, delivering care, and all of us being involved in different parts of one's mental health care. So psychologists, neuropsychologists, therapists, family therapists, and especially when we are treating children, we're not treating them, isolated and in a vacuum. We're really treating them in a very systemic way within the system, and that involves school, parents, family therapy, parental counseling. We need sometimes extensive neuropsychological or psychodiagnostic assessments. All of that together really helps us to be more effective as opposed to being alone. And in the private world, I felt that's really not happening. We try to maybe reach out to a clinician, and sometimes it happens, sometimes it's hard. And with that mindset, after 2 years of solo practice, I founded Mind Study Center with that exact mission, where we can bring all these experts from different areas in one location, and being able in one convenient location to deliver care. Here, we truly have an open door policies. I actually pass by and I see one of our psychologists is chatting with our family therapist about a mutual patient. Yesterday, we had our clinical meeting, and we sit in a table, and I might be the psychiatrist. Dr. Mareki did the neuropsychological assessment. Abigail did the is a psychotherapist. Another therapist is doing family therapy. So now we are all coming together, talking about the same family, same patient. We're all up to speed. And that really has changed how I practice and how others practice. And that's what really attracts people. I feel we are much more effective this way. And the other thing is, now I'm able to integrate all aspects of what I've been really enjoying about psychiatry, whether it is reducing stigma, mental health education, public awareness, what we can do to increase access to mental health care, and then also focusing on prevention. This is something that is not easy to do in every setting. And in this setting, we've been able to do it.
That is amazing. I think to continue on in with that passion and enthusiasm, let's talk about what's going on in the mental health field right now that you're pretty excited about.
Oh, where do I start? There is so many. There is so many. Of course, there are things that we are becoming more and more aware of. Whether it's increasing access to mental health, reducing stigma, focusing on prevention, as Tom shared. The best care is actually not get to a point of a disorder or an illness. So if we can prevent, we've been successful doing that with cardiovascular diseases such as smoking, drinking, and we've made huge impact with colorectal cancer. So prevention is the key, and we need more more of that in mental health. I know sometimes it might seem vague, but we have enough tools and information to do that and utilize it. And of course, continuing with research and innovation, and which has been ongoing. I'm really excited about also how technological advancement is coming to our field. For the longest time, we might have been very much limited to medications only or psychotherapy only, but we are actually expanding and using other innovations, such as TMS, transcranial magnetic stimulation. Now, I really see it as a medical breakthrough. We're now able to localize areas of the brain responsible for mood regulation, such as the dorsolateral prefrontal cortex of the brain, 1 or 2 inch area right here. And we can very nicely localize that area and use a non-invasive procedure, less invasive than medications, and utilizing only magnetic fields to stimulate those exact neurons or nerve cells in the brain and be effective for treating depression and other conditions. We know a lot of times our medications in clinical trials, if they are a first antidepressant is successful 50% or more, we are very excited. That's great news. By the time you go to the second antidepressant, because the first one was not effective, we go all the way down to 20% and lower. And then TMS, coming in for treatment-resistant depression, meaning they did not respond to 1 or 2 medications, is showing us efficacy anywhere from 65 to 90%. So this is really exciting, and I'm really excited. As of March 22, one of the TMS devices was FDA approved for 15 and up. So it's already coming to the adolescents, and I see this as more effective way of treating some of these treatment-resistant depression. The other thing is virtual reality. Now we are actually using, by the way, we've started TMS here, and it's been really successful, and our patients have been benefiting from it significantly. And what I'm proud to say, again, consistent with our model here at Mind Study Center, it's direct physician involvement. There is always a physician here. There is always interactions. It's not just that go sit on that machine and somebody else is going to do it. We are hands-on. And that was a reason that I wanted to make sure that we bring this technology here. We started doing virtual reality assisted psychotherapy. Now, for a lot of conditions that requires exposure therapy, such as phobia, anxiety, PTSD, OCD, we are able to simulate environments and situations that mimics the triggers and actually treat a lot of these conditions with VR. So this is another exciting things that I see, more and more of. The other things that, of course, we are hearing all and excited about AI and machine learning. I don't think we are there yet, but are we going to get to a place where we can utilize these tools, diagnosing mental health conditions more consistently, predicting treatment outcomes, or personalizing care? So this is really another exciting area, along with actually genetic testings, where we can personalize treatment plans based on the genetic information and helping determining what medications can be useful with area called pharmacogenetics. We are still not there with pharmacogenetics. Some commercial companies may advertise that, oh, we can use this genetic testing and tell you exactly what medications you're using. And I have to have a long conversations with my patients that, these are just genetic testing or genetic profiles of our liver enzymes. They're not yet as informative as we would like to. And I touched some areas. The last thing I want to say is wearable technologies. They're very exciting. I'm not sure where we are, but can we get to a place that we can have devices that monitor, physiological indicators of stress and mood, and providing real-time data to help clinicians and patients and be more effective in our treatments? So there's a lot going on. These are just a few things on top of my head.
Yeah, and that's, I think the nice thing about Dr. Khachi's research background and sort of academic pedigree is he can critically be aware of the research and what does work for the patients. And I think, like he mentioned, there are plenty of companies that you can go plunk down thousands of dollars for pharmacogenetic psych testing, and they'll claim, right, it could be very helpful or miraculous information. And as hope, maybe one day, but as Dr. Khachi mentioned, we're not there yet. And there's some other imaging technology that's not, there is lots and lots of very exciting things, but only some of them have the evidence to really back up their use right now. And it's important, or it's great for the Patients of Mind Study Center that Dr. Khachi's background and training, keep it so that his patients are only getting proper
it's our motto. I feel like it's written all over Mind Study Center. We practice evidence-based medicine. We are excited for these technologies, but we're not there. And unfortunately, some companies may take an exciting idea and run with it and commercialize it, but it doesn't mean we are there. So where we talk about wearable technologies or genetic testing, yes, we do want to use these one day. Imaging studies, we want to be able to one day, get a nice fMRI and be able to predict conditions and outcome, but we are not yet there. So, and those who unfortunately claim at this time and age that they can do that, the research is not showing that. We don't have the scientific evidence that we are yet there, but one day we will. And I always need to sort of remind our patients that, don't follow what sounds innovative, but it's not yet evidence-based. I am excited for it too, but I do not want people to get into treatments that have not shown yet to be evidence-based, when we actually do have evidence-based treatments for the same exact conditions. So it's really important to, building that trusting relationship with your psychiatrist, psychologist, therapist, where you can be sure you are getting evidence-based recommendations.
Right. So let's flip things around a little bit. We just talked about things you're excited about. Is there anything about the current state of the mental health field that you would change?
Oh, yes, a lot. Where do I start? Well, of course, the main one that's every day on our mind is access to mental health. This is increasing access to mental health services. And people have different ideas, and I think they're all valid. I think addressing the shortage of mental health professionals is one thing. We need more training programs, more incentives for our young medical doctors to actually choose psychiatry over other fields. And I sympathize. It's not easy to become a psychiatrist. For even becoming a child and adolescent psychiatrist, they could pursue becoming an orthopedic surgeon or a plastic surgeon. 4 years of general psychiatry, 2 years of child and adolescent psychiatry. That's 6 years post medical school training. So it's long and it's difficult, but we need more programs, and we need to incentivize more medical doctors to enter this field. The other thing that I feel is important is advocating for better insurance coverage for mental health services to make care more affordable and accessible. Of course, this is a big topic, politics, policies, there is a lot to say. But if mental health conditions were reimbursed and clinicians were able to actually treat and see more patients because this is feasible, then that would bring more accessibility. Part of the challenge is many clinicians and psychiatrists are not on insurance panels because it's difficult to run their practices, as reimbursements are not really comparable to any other medical fields. Whereas mental health is so important. 1 out of 5 children, 20% of children will experience a mental health condition that absolutely deserves mental health care. So you can imagine, but there is no access. So those are definitely areas that I feel is very important, and topics that, of course, comes to mind. Focus on prevention, emphasizing preventive measures. That's not happening as much. Supporting for specific populations. That's another area, providing targeted support for groups with unique mental health needs, such as veterans or LGBTQ plus individuals and those with chronic illnesses. So we need more specializations in these areas. And of course, research and innovation. Not only in making another similar antidepressant or antipsychotic, but really more innovative measures, and hopefully for biomedical and pharmaceutical companies to be incentivized to actually expand their research.
Yeah, no, and we've talked a lot on the podcast about how the majority of mental health clinicians don't take insurance. And yeah, a big piece of that is the reimbursement amounts are not up to other fields. And then the other caveat there is it's even if you manage to get a reasonable reimbursement amount, submitting your claims to insurances and dealing with the headaches of getting those payments in, that's something that Ripsy is trying to streamline and making some progress. But when over half of providers in a given field are not using insurance, like that is, and especially for mental health, it affects all of us. It is gotta be.
Absolutely. It reduces access for all.
Steve, is there anything else about the mental health field that you'd like to shed some light on?
It's a big topic. I think each one of these points I shared with you, I can go on and talk about. Sure. But definitely, in a nutshell, these are areas of focus, and I think we are making some progress, but progress has been slow. And hoping we can get to a place not only we have better access to care, but also really treating many psychiatric conditions and improving quality of life for children, for adolescents, for adults and families.
Yeah, and I think, right, Parker, so there's not too many physicians like Dr. Khachi who have the and I don't know if it's entrepreneurial spirit or drive or frustration with the current system to just actually, hey, I'm gonna build this multidisciplinary center that's working hard to do the right things and evidence-based treatments. And I wonder, Steve, when you reflect on when you started, where you are now, and I just envision Mind Study Center getting bigger and bigger and expanding throughout. But yeah, what was it that was driving you to take this path? Because it's more than just the clinical care and some teamwork. There's something else.
Well, Dr. Tarshis, you've been definitely an inspiration, and throughout my training and the work together, I found it always admirable. What you have done with other clinics, and I, as I started my own sort of practice, initially it was frustration with the system. I felt that I had this excellent training where I could be very impactful in my patients' lives, but many times my hands were tied. And there was so much bureaucracy and hoops and challenges that I had to go through in order to deliver the good care, the right care that everyone deserves. And that was very much challenging, and still is challenging. And the other part was that I felt I am not as effective when I practice alone. and this is a very complex field that requires different experts to come in and working with different angles of mental health. And that was definitely another part that really inspired me, that how can I bring a very good sort of group of professionals who do different things in one place, and being able to start not only diagnostically to be very much on, sort of correct and be on the right path, because that sort of sheds light on what we're going to do, coming up with a treatment plan and be able to provide that treatment plan that we think it's the right path. So all of that led to founding Mind Study Center, where still there are those challenges. We still have to deal with insurance, pre-authorizations, but we've been trying to reduce as much obstacles as we can to narrow down and really focusing on good patient care. And the people who come and work here and want to be part of the Mind Study Center family, they come for that reason. They bring their expertise, but then they are really focused clinically what they can do for their clients and patients without all of those obstacles, which I deal with in the background.
Yeah, awesome. Yeah, no, and so just trying to do the right thing and enough leadership skill and quality, and it's great to see. And yeah, it's been great to see where you've been and where you're at and where you're going. So yeah, congratulations and strong work on behalf of our patients and society, really.
Thank you.
So keeping the focus on Mind Study Center, I understand that you do organize events from time to time. Do you want to talk about maybe some successful events you've had in the past, and maybe let us know about any that you have coming up?
Sure. Yes. Again, part of our mission is, reducing stigma, getting information out there, and letting others know what we do and why is this different. I usually tell parents that navigating the maze of getting mental health care is really complex. I am in this field, and sometimes I feel confused and feel overwhelmed by where to go. But imagine someone who's not in this field and they want to, their child is struggling with attentional difficulties, behavioral problems, depression, anxiety. Where do you start? Who do you go see? What do you do? Right. So that's definitely one of the challenges that I'm sure many would share. And part of that, our mission is public awareness and education. We've been consistently going to all the surrounding schools in our communities and giving talks to parents. So there's a lot of parents' education nights that we organize, and we go there and we talk about different conditions, getting mental health care. So that's been really a successful series of events that we've been doing. And usually we go as a team. We go with a neuropsychologist, a child psychiatrist, a therapist. So that way we can really bring our model and show exactly how we do it. So it's not just a one person, doing it all. The other thing is in the community, we actually had recently, we moved to a new location here, and we had our open house a few weeks ago, which was great to bring all the colleagues in the area and psychologists, psychiatrists, therapists, educational therapists, schools, all come and see what we do, how we do things, and also learn about them. We are very much interested in finding like-minded people so we can actually have ongoing collaboration with. So that's been really nice to have these sort of open house, and we plan to do more of it, not open house, but maybe having more workshops, educational sort of lectures, and so forth. We usually show up and go to different sort of organizational shows and conferences. Dr. Tarshis and I usually are at the ACAP, which stands for American Academy of Child and Adolescent Psychiatry. So we have a booth there, and again, just to have a presence that this is how we are doing things, this is our model. And there we are, of course, interacting with other child and adolescent psychiatrists, and hoping to do more of it. The other thing is I'm involved with various lectures, whether it's at USC to other colleagues, or I just had one for the Los Angeles Psychological Association. So in that way, you know, just sharing thoughts, ideas, and different approaches. So a bunch of events are always happening, and others in the clinic are attending, and I think it's an ongoing sort of collaboration within our community.
Well, Steve, it's been amazing learning more about Mind Study Center and more about yourself. And Mind Study Center itself sounds like such an amazing place to both work and to receive treatment from. So I think the hot question on everybody's minds is, are you hiring right now?
The answer is always, we'd love to have like-minded people to join the Mind Study Center family. Those who have the same mission, passion, and desire to focus on good patient care without the bureaucracy. And of course, we are usually interviewing and meeting with people, and I always say that we want people to be here who feel this is the right fit for them. There might be a lot of excellent clinicians that might not be this not be the right place for them, but the right fit is really the key, and we are fortunate that we have gathered a group of professionals such.
Amazing. All right, before we wrap things up, is there anything that the two of you would like to, anything else that the two of you would like to say?
Well, and we, Steve, we usually share a little frustration with running a practice moment each week, and I wonder I wonder if we could see if there's anything fresher than the past couple of weeks that was a frustrating piece of running your practice, or anything that just being a business owner is right, as well as all the other being the researcher and caring for your patients. Any little nitpicky frustration that showed up in the past couple of weeks on the top of your head? And
I think what used to be frustration, it's becoming the usual obstacles in a way, as you get used to them. But it's always about how we can maneuver around obstacles to get the right care for our patients. Like I have patients who are suffering from treatment-resistant depression, and they've been on 10 different medications, ongoing psychotherapy. TMS is the right treatment for them, but TMS can be expensive, and we need insurance companies to step up and getting the right care for our patients, so they don't necessarily get hospitalized, or their quality of life doesn't remain sort of poor as a result of this medical condition. So it's frustrating when insurance companies might reject one, or we know what the treatment is, but we don't have a easier way to deliver it.
Yeah, agreed. Yeah, and that's usually what the frustrating office moments usually revolve around, something with insurance companies that
Yes, or pre-authorization of medications. You know this is the right medication, uh, and an insurance company says, no, this is a brand medication, and we don't want to pay for it.
Right.
And now, many patients might not be able to afford such expensive medications, even though it's the right one.
Very good.
All right. Well, this has been an amazing conversation. Steve, we really appreciate you offering your time for us today, and it's been a wonderful episode. We hope to see you soon, hopefully this year's ACAP, just in a few months. And anything else that Tom?
Well, thank you so much for having me. When you shared with me about this podcast, I was really excited, and I listened to a few, and I'm like, wow, this is an incredible platform, and a place where everyone can come, and whether psychiatrists, psychologists, or even patients, to hear both of you and Dr. Tarshish, your years of experiences in the field and all the challenges, and having a place for everyone to talk about these very important topics. Thank you for doing this, and thank you for having me.
Yeah, no, thanks so much for being our first guest ever on the podcast. Any mental health professionals who are in the LA area or Pasadena are thinking about doing their own thing or looking for a great place to work, like give Dr. Khachi a buzz, and just to see the office he set up and how it's arranged, the philosophy. Dr. Khachi is a great mentor as well, and so I'm sure he'd be happy for anyone to stop by and say hi. But thanks so much, Steve. Really appreciate it.
Thank you so much.
Thank you.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.